If we have not met before, my name is Dr. Michelle Gamble, and my passion is helping people just like you to feel their best. Migraine pain is like no other. Migraines can stop you in your tracks, keeping you from experiencing daily joys. Many of us are told that there's no solution, that we're just one of those unfortunate ones who are going to have to suffer through it. And I have definitely been in your shoes if this is the position that you find yourself in today. So we have plenty to cover today. Let's get started. Before we go any further, just want to make sure I remind you that the information in this presentation is not intended to replace a one-on-one relationship with a qualified medical professional, and it is not intended as medical advice. This presentation is intended as a sharing of knowledge and information from the research and experience of myself and other experts who have contributed to this presentation. We encourage you to make your own healthcare decisions based on your research and in partnership with a qualified healthcare team. So now, just a little bit more about me and why I care so much about teaching people how to heal themselves, and particularly with regards to migraines, because as I said, I was definitely in this position where I was experiencing migraines on a weekly basis. And I couldn't figure out where it was coming from or what to do about it. You know, there are only so many times that you can pop pills, and I definitely didn't want to go the medication route. So I had to do a deep dive, and that's what I'm going to talk to you about today. You know, as an integrative wellness specialist, I'm healing-oriented healthcare provider who takes into account the whole person, body, mind, heart, and spirit, including all aspects of lifestyle. I emphasize the therapeutic relationship, and I embrace the use of all appropriate therapies, both conventional and what we refer to as quote unquote alternative. I teach strong, savvy, selfless people like yourself how to heal yourself, body, mind, heart, and soul, so that you can better serve the ones that you love from an empowered position of joy, health, and wealth. And as you know, all of those things are compromised when you are not feeling at your best. So now, the Migraine Solution can significantly improve your migraine headache complications for good. But here's the catch. The Migraine Solution doesn't work unless you do. The Migraine Solution is only recommended for people who, number one, understand that serious lifestyle changes lead to migraine freedom, believe that they can achieve freedom from migraines, they want to have live access to nationally recognized migraine experts, and they need positive, encouraging community support, and they can commit fully to taking control of their migraines. So the question is this you? If this is you, then continue listening, okay? Now, migraines can be categorized as various subtypes. The first major subtypes are migraine with aura and migraine without aura. Next, there are the root cause subtypes: post-traumatic, facial, thyroid hormone, structural, adrenal hormone, glucotoxicity, reproductive hormones, and environmental toxicity. So now let's first talk about hormones. Let's first talk about migraines with aura, okay? Now, migraines with aura is a headache that strikes after or along with sensory disturbances that they call an aura. Visual symptoms include things like blind spots, which are sometimes outlined by simple geometric designs, zigzag lines that gradually float across your field of vision, shimmering spots or stars, changes in vision or vision loss, flashes of light. Additionally, sensory disturbances include feelings of numbness, typically felt as tingling in one hand or in the face, and difficulty with speech or language, muscle weakness. So this is a type of migraine that presents with an aura. Now, On the flip side, you have what we refer to as migraine without aura. And it is more than just a headache. The pain is debilitating, often accompanies nausea and vomiting for some. And this is the migraine that accounts for 75% of migraines. This was a type of migraine that I had. I didn't really see, like flashing lights or anything of that nature, but just splitting headache. And it was more than a headache. It was just constant throbbing, right? And some of you know what I'm talking about. This headache pain typically is localized in the front of the head and can last from 4 to 7 hours. Associated symptoms include nausea, vomiting, yawning, irritability, low blood pressure, feeling kind of hyper, sensitivity to light, sounds, motion, and sometimes dark circles under the eyes. Now we're going to talk about different subtypes. Okay, the first subtype that we're going to talk about is post-traumatic headache, which is defined by the International Headache Society as a headache developing within 7 days of the injury or after regaining consciousness. As a migraine subtype, the definition overlaps, but is not identical, okay? Now, because post-traumatic migraines are associated with an injury, it's important to identify and understand the nature of the injury for treatment. One of the things that I suggest, if this is a situation that is affecting you, is to consider doing what's called a SPECT scan. And a SPECT scan can be done at one of the AMEN clinics that are found throughout the United States. I'm one of the practitioners with the AMEN clinic. And the SPECT scan will tell you specifically what area of the brain has been traumatized in terms of physical damage. Following a traumatic injury, at least 25% of people with mild traumatic brain injury do not seek medical attention. And migraines can occur due to displacement of the structures within the skull, inflammation. The source may be intracranial or extracranial or cervical, decreased blood flow and or metabolic changes, increased muscle tension in the head or the neck, inflamed irritation of the thin layers of the tissue coating the brain, the meninges, and increased pressure within the skull. Musculoskeletal headaches is the most common cause of head discomfort or headache after trauma, and often one is that is most overlooked. Chiropractic care is a great corrective method for addressing any misalignment that has been created from a traumatic event. Now, this particular subtype, the facial subtype, is associated with numerous treatable causes. Some causes include things like dental issues, including abscesses, or sometimes grinding of the teeth that you kind of do subconsciously, also TMJ, also sinus problems, allergies, trigeminal nerve. Each cause has its own specific treatment plan. Depending on your specific cause, a doctor who is a dentist or an allergist or even a chiropractor may be able to help to determine how to approach your specific issues. Now, the next type of subtype is a thyroid hormonal subtype. Imbalances in the thyroid are linked to numerous conditions, including migraines, believe it or not. And your doctor can order a hormone screening to determine if this subtype may account for your chronic migraines. You know, this is one of the things that I love doing with people, a very comprehensive hormonal panel, because a lot of times when you go to even endocrinologists, they don't do a very comprehensive panel. They'll do just maybe a TSH, a T3, a T4, but they don't do all the other subtypes, you know, in terms of the thyroid, which would give you a much more comprehensive understanding of what's happening with the thyroid and how it possibly be connected to migraines. Of all the thyroid conditions, hypothyroidism is most frequently associated with migraine complications. These symptoms include cold, dry skin, irregular cycles, weight gain, slow heart rate, and constipation. Other thyroid conditions such as Hashimoto's hypothyroidism and hyperthyroidism also may cause migraines as well. Now, the first step, as I was saying before, is a comprehensive blood test to determine if the thyroid hormone, thyroxine, is in proper balance. When determined to be underactive or overactive, then you can start to mitigate with proper supplements, foods, and things of that nature. For hypothyroidism and Hashimoto's disease, there is an underproduction of thyroxine, which requires daily use of support to help the body to produce the proper thyroid hormones. As for hyperthyroidism, there's an overproduction of thyroxine, and there are several ways to address that particular situation. Be sure to consult with your healthcare provider about how you can address these issues. And again, if this is something that you would like to look into from a natural perspective, feel free to reach out to me. Structural migraines are linked to several localized pain in different structural parts of the head. Common structural conditions include neck pain and shoulder tension, the back of the head headaches, chronic position stress, shoulder and upper back strain. You know, especially with the fact that we're constantly sitting at these computers these days and we're hunched over, it will create a misalignment of the spine, and that can lead to curvatures and things of that nature that impinge on different nerves and can lead to migraines. Now, when assessing structural migraine, the source of pain needs to be identified. Correcting the source of pain will effectively reduce the intensity of a migraine. Massage and acupuncture are especially useful techniques for treating structural migraines. Both massage and acupuncture loosen tight muscles and increase blood circulation. Chiropractic care can also be useful. Following identification of which structure is connected to the migraine pain, additional factors will be explored. For example, if the neck pain is the source of the migraine, what is causing the neck pain? What will need to be identified? Most conditions will need to be corrected, and posture correction will need to be addressed. Physical therapy can also help to address the correction of the supportive muscle structures to help to improve and maintain proper posture and eliminate pain. Now, the next subtype, and this affected me, this subtype in particular, as well as the next one that we're going to talk about. Adrenals are the tiny organs that sit atop of your kidneys. They are part of the endocrine system and regulate stress, metabolism, and a variety of other functions. Cortisol and DHEA are stress hormones produced by the adrenals. Chronic stress causes the adrenal glands to produce excess levels of cortisol and DHEA and can lead to exhaustion of the adrenal glands. DHEA is perhaps the most abundant steroid hormone in the body, so its decrease in level can be detrimental to overall well-being. Adrenal insufficiency can be diagnosed with different blood tests that check to see if your cortisol levels are too low. My preference is actually a urinary test called the Dutch test. And the Dutch test is a dry urine test of complete hormones. I prefer this particular test as opposed to blood tests, because blood tests will only show you hormones that are bound to the proteins that are in the blood. They will not necessarily reflect what hormones are actually being metabolized by the body, used by the body. So just looking at a blood test can be misleading. Just because the hormone levels may be adequate in the blood does not mean that your body's actually utilizing those hormones. Now, a cholesterol test may be ordered to determine DHEA levels. But again, you can also determine your DHEA levels through what's called a Dutch test. If that's something that you're interested in, make sure to reach out to me. I can assist you with that. When cholesterol is too low, DHEA decreases over time, leading to a deficiency. A deficiency results in a decrease of estrogen and testosterone as well. One of the useful methods for relieving migraines in this subgroup is stress reduction and relaxation. Relieving adrenal fatigue through calming activities can be particularly helpful. Melatonin supplementation can help correct sleep cycles, which can also alter the underlying issues of having an underactive or overactive adrenal hormone level. Now, glucotoxicity is something that many people don't even realize is connected to migraine. Glucotoxicity is a condition in which the blood sugar levels remain high for prolonged periods. Glucotoxicity indicators include many issues. Including things such as risk of insulin resistance, symptoms of metabolic syndrome, systemic inflammation, more frequent headaches, neurodegeneration, and therefore an increased risk for Alzheimer's. However, if one's blood sugar levels stay consistently too low, frequent headaches may occur, especially late in the afternoon, late in the morning, or sometimes even overnight. Migraines related to glucotoxicity require repairing the balance of blood glucose. And this depends on addressing the causes, the existing conditions, and the severity of the symptoms. Dealing with glucotoxicity is addressing things that are similar in manner as dealing with diabetes. Now, this is the other subtype that affected me in particular, which is the reproductive hormone subtype. Migraines related to reproductive hormone imbalances are more common among women due to the predominance of estrogen-related complications. The fluctuation of estrogen, specifically plummeting levels, is most often associated with ovulation, menstruation, postpartum period, and perimenopause. So when the levels of estrogen drop significantly and do sharply, that's when you will experience migraines. That was the case for me. It wasn't just a matter of having low hormones, but the fact that they would just drop very sharply, very quickly. And the hormone progesterone also has some effect, but estrogen is more often the stronger contributor. And also looking at the relationship or the ratio between the estrogen and the progesterone. So it's not just about having too little estrogen or too much estrogen. It's about how the level of estrogen is in relationship to the progesterone. So now estrogen is believed to be the main reason why women have more migraines than men, which is why women tend to have them right before or during their periods when their estrogen levels drop. There is an increasing evidence that we need a multimodal approach, such as behavioral interventions like biofeedback, cognitive behavioral therapy, relaxation modality, and so on. Magnesium is especially helpful if you're prone to monthly headaches because many women are magnesium deficient, and magnesium helps to calm the nerves when they get overexcited. Try to get 450 milligrams of magnesium a day from foods like spinach, Swiss chard, which gives you almost 40% of your daily need. Other good sources are sweet potatoes, bananas, sunflower seeds, and sesame seeds. Now, the last subtype we're going to talk about today is environmental toxicity. And this can be a tricky one to actually identify because we're constantly exposed to various toxins. Some of the most common toxins include mold, organic toxins such as fungicides, chemicals, pesticides, heavy metals, mercury, arsenic, cadmium, and lead. Treatment varies depending on the type of environmental toxin responsible for your migraine. For heavy metal toxicity, a detox cleanse can help to release toxins stored in the tissue and using certain chelating agents. So also, it's important to identify if you have higher levels of heavy metal toxicity. And again, that can be done through things like a heavy metal challenge test. There is a variety of detoxifying cleansing methods, which we can help you determine which one is better for you, depending on your age, your body type, your lifestyle. And most cleanses incorporate the use of natural supplementation and diet to aid the body's natural detoxification process. If mold is thought to be the cause of migraines, at-home mold kits can be used to determine if you're being exposed to mold in your immediate environment. Depending on the type and the extent of mold infestation, professional removal may be required. Limiting the chemicals around your home can help to reduce exposure to organic chemicals. For example, changing lawn care products to natural alternatives and opting for organic and local produce can help to limit your exposure. So now there are lots of resources that we use to produce this particular presentation for you. And I will be including it in the email that will go out to you and the recording for those of you who registered for the class. If you're looking at this particular video on YouTube or elsewhere after the fact, you can be sure to reach out to me to get those resources. I want to thank everyone for joining me. And if you have any additional questions or you would like to get assistance with this particular issue, please do not hesitate to reach out. I understand, personally, I understand how debilitating chronic migraines can be. Finding a treatment and addressing the root cause of your migraine is the only way to eliminate those issues in the future.